So Elliot was born with a rare genetic neurological condition, and we still, he was diagnosed when he was 15 months old, and we still don't know a lot about it. We're learning, as he got a little bit older and we had more and more hospitalizations. Our team at Children's, thought that it might be a good idea for us to have access to another level of care. We do a lot at home. We have all the machines, we have all of the medicines, we've got our mini ICU that we've got set up here, but just having access to expertise was something that they thought would be really helpful for us. And so the definition is that doctors wouldn't be surprised if he died in the next 6 months, which is a reality for us. Elliot's condition is very rare. We don't have a prognosis. And so, but a lot of kids have passed with it. And so, it wouldn't be surprising. We don't want that to happen that way. You're fighting still.
He's a very happy kid when things are okay. He gives you that beautiful smile, and he lets you know, okay, I see you. What is unique for pediatric patients and how Capital Caring serves them is the concurrent care that's involved. And we work hand in hand with the PANDA team at Children's. We work very closely with home care services, and so we try to tie all of those in together.
When we think about a serious illness, most of the time we think more about adults. But illness does not discriminate, and there are children out there who are suffering from an illness, and their parents and their families who really need that additional support and guidance through that very difficult journey. It really is different for each person what their goals are and what they want their life to be at home. But for most people, it is being able to be at home with their family, with their children, with other siblings, being able to enjoy those moments and not worrying about being in pain or having care needs or having access to resources that can help them do that.
My husband and I have been married for almost 10 years. We have 3 children. My son is almost 8, my daughter is 5, and I have a 6-year-old that is in heaven, Amy. Amy was the reason we started working with Capital Caring. Capital Caring helped us take care of our daughter at home. I think the most valuable thing that Capital Caring did for us is having that peace of mind that somebody was taking care of our daughter all the time. While we couldn't do it at night, for example, we had that time to rest and be ready for the next day. And knowing that somebody was there with her was the most important thing for us.
Lets us be at home in a space where it's comfortable and safe, and getting Elliot over to the hospital. His primary doctor is there, and it's just like hospitals are full of sick people, so it's like we just don't want to go there. So it lets us be here where Elliot's most comfortable. And I work full time. I can't get away a lot. So, just being able to have somebody who can come here and look at Elliot and just kind of assess him and help us figure out what's going on, whether we have to be worried, whether we need to go and get a follow-up, or whether it's just something they can help us get, medicine for, or, So just having access to that kind of, medical care in the home expertise is really invaluable.
So when Capital Caring is involved, that's exactly what we're doing. We are helping to ease those fears and concerns. We are educating and teaching this family and empowering them to really be able to care for their loved one at home, and knowing that when we aren't there, that they can always reach us.
You need Capital Caring in your life. You need, these people, and they're gonna come and they're gonna just help take care of the family and these kids who deserve, every comfort and joy they can get, and what is likely to be, shorter, more challenging lives. So
for us, and for those families dealing with the illness of a child, nothing is more difficult, nothing is more challenging And we're proud to be there working with parents and the children to care for them in a way that is important as they go through this terminal condition.